Today the topic we are going to discuss is Nystagmus Part 2. If you still haven't watched the Part 1, go to the link in the description below. In the past video we explained a normal mechanism. When you rotate your head to the right, the VOR system acts and the eyes move normally to the left. But today we are going to discuss is Nystagmus, the condition that refers to the rhythmic oscillations of the eyes. It is defined by the direction of the rapid reflex movement or the very fast phase. Normally, in the VOR, when you rotate your head acceleratory in the direction, the slow phase occurs in the opposite direction. But the cerebrum, if there is any underlying cause, the cerebrum made the correction and that causes the fast phase in opposite direction. And that causes the conditions like diplopia, the double vision and the other many conditions. So what we get that the nystagmus refers to the rhythmic oscillations of the eye that slowly to one side followed by the rapid reflex movement in opposite direction. There are two basic types of nystagmus. Number 1, pendular nystagmus. Number 2, vestibular nystagmus. Pendular nystagmus, it is also known as optokinetic nystagmus. It can occur in any directional like torsional, horizontal, vertical or the combination. And this type of nystagmus can be monocular or binocular. It can differ in both eyes, and the characteristic finding with the optokinetic is that it occurs without the fast phase. So we discuss in detail about the vestibular nystagmus, that is also known as jerk nystagmus. If the unilateral vestibular nerve or the nucleus lean, it may result in the vestibular nystagmus. In a pathologic vestibular nystagmus, the initial slow phase is the response to the pathology, and the fast phase is a correction attempt made by the cortex. It has fast phase, first eyes drift slowly in one direction and then jerk back in the other direction. It is more common than the pendular nystagmus. For example, if the left vestibular nerve or the nuclear lean, because of the loss of the balance between the two sides, the right vestibular nerve is unopposed and it acts as if it had been stimulated, causing the both eyes to look slowly to the left. But then cortex responds by moving the both eyes quickly back to the right and the direction of the fast phase occur. Like in this diagram, you have been shown that the right pathway is known as the inhibition of the extraocular muscles and the green pathway shows the excitation of the extraocular muscles. So for example, if the left vestibular nucleus of the nerve is leaned and the right is okay, so when you turn your head to the right, as I already told you about the VOR mechanism, the eyes automatically look to the left. But then the inhibition is failed and that causes the eyes to look back to the left side because of the cortex responding. There are three types of the nystagmus: the horizontal nystagmus, vertical nystagmus and the rotatory nystagmus, as you can see in the diagrams here. There are many causes, but we discuss some of them, like the unknown or the idiopathic, the disorder of the CNS, metabolic disorders, alcohol consumptions, drug toxicity, or the stroke. To test the vestibulo-ocular reflex, in the comatose patients, the vestibular nystagmus is induced by the performing a caloric test, in which an examiner induces the warm water or the cold water into the external auditory meatus. When the warm water is introduced into the external ear, it stimulates the horizontal semicircular duct and causes the eyes to move slowly to the opposite direction. Because the head didn't turn, eyes moved quickly back by the cortex towards the same ear where the warm water is introduced, and that produces a fast phase nystagmus. But if the introduction of the cold water into the external ear, the horizontal duct activity is inhibited on the cold water side, and the vestibulo-ocular reflex of the opposite side moves the ear slowly towards the cold water ear, and the corrective or the fast phase of the nystagmus move the eyes quickly away from the ear where the cold water is introduced into the same side. So as you can see in the picture, the nystagmus in the cold water occurs into the opposite side, while the VOR in the cold water occurs into the same side. But in the warm water, the nystagmus occurs into the same side, while the VOR occurs into the opposite side. In the abbreviation, we can use a mnemonic that is the COWS, that's COWS, like the cool means opposite. If you put the cool water, that goes the opposite side nystagmus. But if you put the warm water, nystagmus occurs in the same ear. Thank you.